How does stress affect your oral hygiene and oral health? Neglect of oral care. First is brushing is skipped and they rush brushing. Second, flossing is ignored. Third is they postpone their dental visits. This leads to plaque buildup, caries formation and gingivitis. Gum disease, also known as stress-induced periodontitis. Stress level increases your cortisol, which suppresses your immune response. This decreases your capacity to fight towards the plaque bacteria. This forms more inflammation, bleeding gums, and faster periodontal breakdown. Bruxism, teeth grinding or teeth clenching. This is very common in stress and anxiety. The first and the foremost thing that you can see is tooth wear and fractures in your tooth. This leads to hypersensitivity. Direct effect comes on your TMJ, which is the joint, and this leads completely to your headache.